Yeah, it's Howard Barnes here, and I am happy to introduce you to our AI-powered health sharing platform. Okay, this is going to do to the health insurance industry what Uber did to the taxi industry. It is going to totally revolutionize it, reduce costs, and make it easier for everybody to have affordable health care. So what I'm going to do is I'm going to turn it over to Jason and let Jason make the presentation because he does a much better explanation than me. And okay, Jason, you go ahead and take it away, okay?
Here in just a moment as we've got everybody connecting their video and their audio. If you can hear me, that means your mic is on. Awesome. If you can just make sure it's on mute so there's no background noise. We'll have an opportunity to answer some questions here in a little bit. And then if you have an opportunity to turn your camera on, we'd love to put names and faces together. We're not going to call on you, but if you could turn your cameras on, that'd be great so we could see all the great nice
you got it, brother?
out there. All right. And then if you guys can mute yourselves, fantastic. Who's that? Who's talking in the back?
We're good, Jason. We're good.
We're good. Okay, perfect. So welcome everybody. Tonight you're going to learn about Impact Health Sharing. I know some of you are here learning about the service for yourselves. Others of you are here learning about the service healthcare for your employees. And I know many of you are here to learn about our national expansion and how you can participate alongside with us as we go virally. It's an incredible opportunity as we disrupt the healthcare space in a profound way. Before we get started, just a quick question out there to everybody. How many of you feel that the healthcare system here in the United States is a little bit broken? Just a quick show of hands. And if it's very broken, you can put up 2 hands. Oh, there you go. All right. Tom's got 2 hands up right away. I love it. So look, it is broken. Insurance is just is crushing people right now. And so what you're going to learn about is something called self-funding. And maybe you've heard of it, maybe not, but some of the largest companies in the country are getting away from insurance, and they're big enough. They've got hundreds of thousands, millions of employees. They're able to self-fund and provide healthcare for their employees. Well, one of the largest tech companies in the world, actually, and they're in the country here, they developed an AI to run their entire self-funding program. It's been so effective and efficient that it's saving them approximately $2 million a day. We agree that's pretty substantial. Now, they weren't commercializing. They were using it for internal use. We got wind of it. We asked, hey, can we license it? They said, yes, we did. We've made some tweaks to it so we can commercialize it. We've now got several patents on it with a patent pending as well. And now we're able to bring this same healthcare transformative technology to individuals, families, small businesses, medium businesses, and large businesses that would not otherwise be able to participate in a program like this. So that's what you're going to learn about today. It's very exciting. So we're going to get right into it. Some of you I know had a chance to look at our website and see some of the videos. If you did, great. If you didn't, no worries. We're going to get you all cut up to speed. So we're going to have fun for about the next 10, 15 minutes, followed by some Q&A, and then we'll get into our expansion for those of you who are here for that. So thank you all for being here. We're excited to have you. My name is Jason Bergman. I'm going to take you through the first half of this overview. So let me go ahead and get us started. And so here we go. So tonight, as I said, you're going to learn about Impact Health Sharing. It works better and actually feels better than insurance. And you're going to learn why this is really revolutionizing the healthcare space here in the United States. All right. But before we do that, let's talk a little bit about healthcare in general. For those of you who have health insurance and pay your premium every month, you know that almost half of what you spend goes to cover profits and admin costs. So money you're spending that you think is going towards your healthcare isn't. So imagine if you could take the profit out of healthcare, what we could do with that money. And if you're a young person, almost 3/4, if not right about 3/4 goes towards that. So there's a lot of money we're spending that's not giving us healthcare. Okay. It's going to cover other things. In fact, 5% of the population is responsible for half or more of the annual healthcare spending, which means for the rest of us, the 95% who are healthy to fairly healthy, in addition to covering profits and admin costs, we're subsidizing the 5%. We're paying for their healthcare costs so they can spread it around and make healthcare affordable, right? But we're paying way more than we need to. More than 70% of all bankruptcies are a result of medical bills from unpredictable events and illnesses. And I thought I was a minority when I saw this category. I'm in the majority, as most of us are. Almost 90% of Americans never reach their yearly deductible when it comes to healthcare. Any of us fit in that category? And here's what that means. It means that every penny that you spend on your healthcare premium is pure profit for the insurance company. Because if you don't meet your deductible, then they don't have to pay out anything. So that's look, the cards are stacked against us. Now, that's how we're all doing as far as the healthcare industry goes. How are the insurance companies doing? They're doing great. Record profits. In fact, the first 6 months of 2023, nearly $700 billion in revenue for the top health companies. And last year, the top 7 CEOs raked in almost $300 million in compensation. Can we agree there's a lot of money being made in healthcare? And it's not coming our way as far as the healthcare that we're being provided. Okay, so again, as I said, the cards are stacked against us. Another way that health insurance companies kind of hang on to your money is they find ways to deny claims. There's billions in lawsuits right now against so many insurance companies. So, insurance, they're trying not to. In fact, Cigna was caught having their doctors reject claims without even reading them. You can see here in the red box, there was a period of 2 months last year. Over 300,000 requests were used for payments to use this method. They found that doctors were spending an average of 1.2 seconds per case. That's kind of a red flag. So look, the insurance companies, they're making money hand over fist, and they're giving as little back to their clients as they can because they're for profit, right? So here's why this is happening. We've got something called centralized healthcare in the US, and this is what you're used to. You pay your insurance premium, it goes to the insurance company's central coffers. Now, where does the money go? Anybody know? Can you track every dollar you spend on your healthcare? Let me fill you in. First of all, obviously, profits and investments. Insurance companies, their prime directive is to make money for themselves, for their stockholders, for the CEOs, top executives. Obviously, they've got money going towards administrative costs and advertising and marketing, salespeople in place. Notice I didn't mention anything about paying claims yet, because that's last. Doctors, and hospitals and clinics are last on the list. So look, the disadvantages are it's an expensive system with very little accountability, lots of bureaucracy, few choices, and it's clearly not transparent, okay? So what do most people want? Well, there was a survey done, and they asked, what would people really like when it comes to their healthcare? And if you're like me, you're going to fit into all these categories. We want affordable monthly premiums. We want copays that are affordable. We want deductibles that are within reach. Have you noticed that not only are premiums going up, but deductibles get higher and higher? They're dangling that carrot further away from you. If the deductible is high, you don't reach it, more profit for the insurance company. We want to be able to, if we work for a company, we want our employer to offer great healthcare, not just something that they have to do because they're mandated. And when you turn around and use it, it's expensive or the coverage isn't there and you got your paycheck being, piece of it's taken out every week, right? For those of you who are self-employed, you also want great healthcare as well. And we all want to be able to pick our doctors and hospitals. We don't want to be told, we don't want the insurance company getting in the way of our doctor, our hospital, and our healthcare. And clearly, with drug prices on the rise, what's happening with Big Pharma right now, we want affordable prescription drugs. So in comes Impact Health Sharing to the rescue. And with our incredible AI and our disruptive technology and the fact that we're not for profit, we can do a lot of things that the insurance companies can't do. So being nonprofit, we can offer healthcare at a better price. With our technology, we're able to offer comprehensive medical care and no provider network. Think about that. You can see any doctor, any hospital you want. You don't have to get a referral. See a primary care physician first. We're not going to get in the way of your healthcare, okay? So that's great. We have built-in free telemedicine. So if you want to see a doctor online, you don't feel like going, spending 2 to 3 hours to and from the doctor's office, we got free telemedicine. You can get, and you'll see a little demo of this in a bit, but there's never cost. And there's no upfront cost, and you're not billed at the back end. You can see a teledoc as many times as you want, a day, week, month, okay? You can use all of Impact services nationwide. We have some of the lowest prescription drug pricing, incredibly low. In fact, we have yet to see any company or any plan beat our drug pricing across the board consistently. And because we're both affordable and comprehensive, we've got plans starting as low as $73 for individuals and as little as $370 for families of 3 or more. And now for the very first time, folks that are working here from Guatemala, Mexico, Canada, they're working here with a tax ID number. Maybe they don't have a social security number. In the past, without a social, you couldn't get health insurance, clearly you still can't. We said, that's not right. These are folks that are working hard here, contributing. Why not offer them health care? So as long as they got a tax ID number, USTIN, and they can get health care same as you and I, you get some incredible coverage. And the staggering statistic is that, we have 100% of our eligible claims have been paid to date, year over year. It's tens of thousands of claims, year over year over year over year. I challenge you to compare that to your insurance company, which are currently having lots and lots of lawsuits for unpaid claims. So we take care of our members. It's members first because we take the profit out of healthcare. Who can we help? Singles. We can help seniors. In fact, we've got an incredible senior supplemental plan. If you're 65 years and older and have Medicare Part A and B, you can get incredible supplemental care, lowest in the industry, and no pre-existing conditions. And whatever you have when you sign up is covered. For groups, we can handle small and large businesses. For families, 3 or more, as I said, we've got amazing pricing. So we can help just about everybody who's healthy, fairly healthy. Okay. So everything I'm showing you is designed to not only save you money, but give you a better healthcare experience, because the two need to go hand in hand. We're not going to cut costs, right, and then cut care. We want to give you better care for the same or less money. So we have something, the way we manage billing, we have something called reference-based pricing. How many of you, again, just participate if you'd like, with a show of hands, have ever been charged more than you think you should have when it comes to your doctor or hospital? Anybody ever feel they've been overcharged and know someone who's been overcharged? It's standard in practice in the industry, okay? Well, something called reference-based pricing. Every state has guidelines on what the doctors and hospitals are supposed to charge. We know what those are, and we hold the doctor to it on your behalf. So you don't have to wait to get a bill and then try to negotiate. With Impact, just like your insurance company, they're going to bill us directly. They'll bill Impact directly. Impact's going to renegotiate that price on your behalf before you wind up having to pay anything. So it's just another service we offer. In fact, we're saving our members on average 73% off the price that the doctors and hospitals charge. Here's a few examples to give you an idea of how significant this can be. We got one member, they had an incident that was $16,600. When we got done with the facility, it was a $2,300 charge. That's it. Here's another one, just over $3,000. When we got done negotiating, it was $288 and change. Pretty powerful. Here's a hospital stay, $152,000 and some change. When we got all done with it, $36,611. So substantial savings because we work for you. Impact works on your behalf, right? You come first. All right. Now let's talk about pre-existing conditions. Remember, this is designed for the 95% that are not, the 5% that are responsible for more than half of the medical bills. So how do we handle pre-existing conditions? It's very fair and it's really simple. So what is a pre-existing condition? It's any condition in which known signs, symptoms, testing, diagnosis, treatment, or use of medication occurred within 36 months to membership based on your medical records. So if it's not in your medical records, it's not going to be a pre-existing. And if it happened longer than 36 months ago, it's not considered pre-existing. So if you got something that you dealt with 4 years, 5 years, 10 years as a child, whatever, not going to be even going to come up as a pre-existing condition unless you've had something happen within 36 months from sign up. In addition, if you sign up for Impact with a pre-existing condition, you're going to get all the benefits of the drug pricing, the repricing of your hospital stay or your doctor's visit. It just doesn't get applied towards a payout. That's the only difference. Now, if you sign up with Impact with a pre-existing condition and you go 36 months without that pre-existing condition cropping up and being an issue, it's no longer considered pre-existing. So it's really very fair. And if you're someone where you know someone that's got high blood pressure or high cholesterol, those are not considered for pre-existing conditions. And everything is in our guidelines. It's very straightforward. You can go to impacthealthsharing.com. There's a whole section on pre-existing conditions. And you can always talk with an Impact specialist if you have any questions with regarding that. Okay. All right. Now let's talk about getting a quote. Super simple. So for the most part, you go to impacthealthsharing.com. You can do this on your own with the person who invited you. You go to the pricing section, and you're going to get the screen here that's on the right. It's really simple to get a quote. It takes like 30 seconds. You type in your birth date if you're an individual, or the birth of the oldest member of the household if it's a family. And then you choose the number of applicants, 1, 2, or 3 plus. So if it's a family of 3, 5, 8, 12, doesn't matter. It's 3 plus. Click get quote, and you're going to get your result immediately on what you'll be charged. Now, why is this important? Again, everything we do is designed to save you money. So for example, this was a family of 5. They fall under 3 plus. Their monthly amount, okay, like their premium, we call it a share amount, would be $605. By the way, it would be about 3 times that with an insurance company, okay? And if that, I've had a family of 8, same price, okay? So the bigger the family, the bigger the savings. And this would come along with a monthly deductible, we call it a PRA, primary responsibility amount, of $2,500. Now, why is ours a little different? Let me explain. With an insurance company, you've got a family deductible, but each member also has their own deductible that they need to meet typically, okay? So if one family member meets their deductible, the others haven't, okay? With us, everybody in the family contributes to one low yearly PRA. So if you have a family of 5 or 6 or 8 and one person hits the PRA, the whole family has met that deductible for the year, or everybody's contributing. So it's the bigger the family, the greater the savings, tens of thousands of dollars, if not more, over the course of years or decades, as long as you're on health coverage. Okay. All right, now let's talk about how you use it, because on the inside it's very different than insurance, but for the doctors and facilities, it works just like insurance. So it's real seamless. Simply present your membership card, looks just like an insurance card. On the front, you see all the ID numbers and the provider fees. By the way, check this out. I would challenge you, if you have insurance, to take out your insurance card and compare our provider fees with yours. You can see here our telehealth is $0, never cost. If you go to urgent care, it's only $75. Go to the emergency room or for an inpatient procedure, it's $150 is your provider fee. I think my previous insurance was over $600. Okay. Now on the back of the card, you're going to see the EDI payer ID number. Why is this important? You may not know what that is, but the doctor, the receptionist, the hospital, they do. It's the billing system that we're on alongside of the insurance companies. We spend a lot of money for this to work and feel like insurance when it comes to the providers. So if they've never heard of Impact, no worries. They can just pull us up on the system, and they can see that they can bill us directly. We can even set them up, if they've never used Impact, the same day, where insurance companies can take months to get on their billing system. And they're also going to see how fast we pay. We're I believe, the fastest in the industry. We're paying doctors and hospitals on average in 12 business days. So your doctor, your hospital is going to love working with Impact. We can even make them a preferred provider and get them on our preferred list. Okay, so super simple to use. So let me show you what it looks like as a member, because I am a member. And so here's a glimpse at my portal. So the first thing when you log in, you're going to see our member center. This is where a lot of families or individuals can put prayer requests in, because we've got folks from all different religions, non-denomination, doesn't matter. We're a community that really supports each other. So whatever is ailing you, if you want to prayer, we'll all support you. It's pretty powerful. Okay. Now, this is my my portal here. You can see I was paying over $700 in my prior insurance company a month. I'm paying $167 now with a lower PRA or deductible. And I can see there's a balance on my account. I can see which families my monthly share amount is helping. I can see my admin fee. I can see everything, because everybody has access to see their own individual account. You can see exactly where your money's going, what it's going to, who you're helping, who's helping you. It's amazing. And again, completely transparent. Now, let's suppose you want to see a doctor. Not feeling well, maybe an earache, sore throat, nothing too serious. You don't feel like going to the doctor's office and spending hours and money. You can see a teledoc. So for example, I click on Arizona, you see medical visit, $0 per visit, okay? And then you can put in what's ailing you and some symptoms and all that good stuff. And then click next, and up will come the doctors that can see you in the next little bit. Choose one. They can see you video. They can talk to you over the phone. They can prescribe medication for you. It's pretty amazing. Before you have it sent to your traditional pharmacy, use our drug and pharmacy portal. It's an incredible tool that you have at your fingertips where you can check pharmacy and drug pricing, because not all pharmacies and not all drugs are equal. Now remember, across the board, we're going to save you money anyway against all the other plans. But our program pits pharmacies against each other. So you can see here, I had a gentleman that needed insulin who was paying $115 prior with his old insurance company. You can see here $54 with bashes and fries. But with CVS, even though he's saving money with those others, it's only $15. So a $50 savings versus a $100 savings. Now he didn't know. He was shocked. I wouldn't have known this. Would you have known this? So normally I would send my drugs to Walgreens. Now, not all the time will one be lower than the other. So check, see, sometimes the drug is more at one pharmacy than another. You can search by area, but this is at your fingertips. This is all included in your monthly share amount. It's pretty amazing, okay? All right, now let's real quickly talk about small business, because I know we've got some business owners on here. Welcome, by the way. I know many of you are struggling when it comes to healthcare because of the cost. You'd love to offer your employees health insurance or some kind of healthcare plan, but it breaks the bank, right? Well, 90%, you're not alone. 90% of small businesses don't offer healthcare because of cost. They'd love to offer because it's great for employee retention and new employee attraction, but it's very expensive. Well, Income's Impact, and on average, we're saving companies 40 to 50%. We have more people opting in. We have more families opting in, because as you saw, families with 3 or more, it's not any more expensive. So a lot of times the employer can cover that cost, or it doesn't cost much more for the family to be added by the employee. And really, Impact comes in and does all the heavy lifting. They'll educate your employees on how it works. We have all these great benefits, and the best part is it's year-round enrollment. So while we're in open enrollment right now, and this is top of mind for a lot of businesses, if you have an employee that joins your company out of the insurance enrollment period, you can now offer them healthcare right away. They sign up that month, and their coverage begins the following the first month. So it's a great way to attract and keep employees. Okay, they get the same great coverage. All right, so real quickly, let's compare health insurance again to Impact. Remember, With Impact, you're going to save typically up to 70% against the traditional health insurance premiums. This is saving families on average close to $10,000 or more a year. By the way, let me ask you all a question. How many of you, if you weren't sacrificing your healthcare and you were actually getting better healthcare, could find a better use for 10 grand every year for your families and yourselves, right? Think about that, okay? Remember, we have one low PRA for households. It's not, a per family deductible. No network, you're not stuck. See whoever you want, whenever you want, wherever you want. We're even approved at the Mayo Clinic. That's how powerful this is. We have some of the lowest drug pricing as you saw, lower copays, co-shares, provider fees, telehealth, 24/7, 365 days a year. Use it, it's phenomenal. And again, we're helping millions of folks that would otherwise not be able to get healthcare in this country, and we're helping them, okay? When it comes to your doctors and facilities, remember, we're paying doctors on average in 12 business days versus 2 to 6 months on average. This is why a lot of doctors don't even want to take insurance anymore, because they're tired of waiting for their money, right? They love us. And we actually pay more money because we don't manipulate the doctors and hospitals with in-network and out-of-network. See, when the only purpose of the networks is the ones that are in-network have agreed to take a lot less money than they want so that they can be in-network for their insurance, okay? We actually don't have networks. So guess what? Because we take the profit out, and because we don't have a network, our doctors actually get paid more money faster. They love us, okay? Okay, remember, insurance companies looking for reasons not to pay. There's billions in claims right now against the top insurance companies because, look, whatever they need to do to hold on to your money, that's what they do. We paid 100% of our claims to date. It's pretty amazing. So what I want to do is I'm going to play a few quick testimonials for you. I just want you to hear some people, their experience, not only what it's saving them, because savings is great, but the quality of the healthcare that they're getting is powerful. So give a listen. I'll just make sure I got the sound on here. 1 second. Yep. All right, so give a listen, and then I'll be right back. Okay, here we go.
Me and my family, we were paying $1,648 a month, and now we're paying $605 a month. We save $12,000 a year.
I'm loving Impact. Oh my God, I went from $600 a month to just over $250 a month. Lower deductible, open network, go to any hospital doctor I want, and the prescription drug pricing is absolutely unbelievable.
Impact for me has saved my husband and I tens of thousands of dollars since we have been a member. I have always been quoted $1,400 to $1,700 a month. We now pay $548 a month. I'm absolutely so excited about this.
I was with Blue Cross and Blue Shield, family of 4, paying $1,500 a month. I went to Impact June of last year, dropped my cost from $1,500 to $650. That's over $10,000 a year I'm saving on my healthcare costs.
I'm a single mom with 2 kids. Was originally going to pay over $1,800. Now I pay $433. But what I love the most is when I had to use it a few months after I got it. My son took a baseball to the face, ended up with a very bad concussion. Got a call, he needs to see a specialist. I was able to see that doctor, had no pushback. Impact helped pay for it. Instead of being a $500 cash pay to that doctor, it was a $75 copay.
So I decided to join Impact. I was able to get 50 outpatient procedures included at no additional charge. And then there was the no network. See any specialist, which is something I'm looking to do in the near future, anywhere in the country.
I'm a realtor and I didn't have insurance and I was just running around without coverage. So I looked into several expensive plans, couldn't afford it, but I finally saw Impact and I was just amazed by the plans that were available for around $200 a month for me. I'm just super grateful. Thank you so much, Impact. Thank you for everything you do.
Awesome. And that's just a sampling of the tens of thousands of people who are they're actually excited about their healthcare. They're excited about what it's doing for their families. They're excited about the money they're saving. They're excited to share it with other people, which is amazing, especially right now when people are so stressed out about their healthcare. Before we open up for questions, I do want you to hear from one person, and she's an incredible young lady. She's a physician assistant. And the reason why her story is powerful is, she's actually an Impact member, but she understands healthcare, not only from a consumer side, but from the billing side, the medical side. So she's got a really unique perspective. So please help me welcome to tonight's webinar, Ms. Heidi Huff. Heidi, would you share your story real quick?
Hi, yes. Hello, everybody. Good evening. Thanks, Jason. My name is Heidi Huff. I am a physician assistant. I practice medicine for 10 years, internal medicine, family practice. And I'll tell you, I love medicine, but one of the biggest causes of burnout is not being able to provide to the patient what I know they needed when they needed it, because insurance always got in the way. Insurance would dictate what we could prescribe, what specialists people could see, what tests they had to get done first, if they had to go to physical therapy before getting that, you name it. Probably some of you have gone through the headaches of insurance dictating your medical care. We on the provider side really felt it, and it became very frustrating. I got introduced to Impact, and I thought, oh my gosh, this is a dream come true, because they don't get in the way of what the doctor says you need. If the doctor says you need an MRI, you get it. If you need to go see a specialist, you can even go see a specialist. You don't even have to see primary care first. So talk about streamlining our access to healthcare and ability to take care of patients. I got so excited that it was cost effective, that it paid doctors' offices fast, keeping doctors' offices in business, and was affordable to families, to employers, for employees. And so I got behind it. I use it myself, even as my own family myself. And I can't be more excited to be on here tonight promoting this and having you guys learn about it. So thanks, Jason.
Oh, awesome, Heidi. And thank you so much for sharing your insight. So what we're going to do right now is we're going to take a few moments. I know there's a lot of you on, so we don't have a lot of time is limited, but if there are some questions, maybe we can field 2 or 3 questions. If you have any, if for those of you that are looking at the service for yourself or looking at for your business, if you have any questions you want to clarify, or that's fine, we'll take a few moments. If not, it's okay. You don't have to have a question. But if you do, we're here to take a few moments. And then we're going to get into our incredible expansion as we grow virally. So if there are any questions, feel free to raise your hand or unmute yourself, and we'll go from there. And if not, we'll move on. So.
Hey, Jason, thanks so much for the explanation. That was outstanding. You do a great job with that. Appreciate it. So anybody out there that has any questions, reach out to the person that invited you to the explanation, and they can help you with those questions. And also, if you're ready to get your healthcare going and save a whole bunch of money, we can help you with that as well. So anyway, it's our pleasure to help you, and and you'll appreciate it. And just your decision now is, what are you going to do with all the extra money you have in your pocket at the end of the year?